Hello, my name is Kahn, and I'm the state representative from the 11th Middlesex District, representing about half the city of Newton. I'm also honored to serve as the House Chair of the Joint Committee on Children, Families, and Persons with Disabilities, and have done so for 11 years. I am so pleased to be speaking to you all today, and thank you very much to the Federation for Children with Special Needs for inviting me. I'm happy to provide today the most up-to-date information on the policies and projects I have been working on the last couple of years. I've had the privilege as House Chair of this committee to work on the Commonwealth's child welfare policies. After budget cuts due to the recession of 2008, the Department of Children and Families has been receiving increased funding appropriations over time from the legislature in order to more adequately serve the children and families who greatly depend on its services. Social workers have manageable caseloads now and have the technology to seamlessly work from home. The establishment of the Family Resource Centers has strengthened families by connecting them with innovative services and programming within their own communities. Today, as we grapple with COVID-19 pandemic, we have to look at this work a lot differently. The needs of families, foster families, and providers have changed, and the Commonwealth must be responsive. During the early stages of the pandemic, when we started working virtually, I met with Commissioner Spears and her team at DCF every couple of weeks to get updates and give feedback on the rapidly changing landscape. Additionally, I met with the child advocate, Maria Mercedes, and now continue to be in regular communication with both of them. The COVID-19 pandemic has also amplified the need for data and information on the Commonwealth's most vulnerable children and families. DCF developed special COVID-19 reports that will now provide the legislature with a clearer picture of how we can best support children and families served by DCF during this public health crisis. As noted in the reports, 51As have decreased by 31% since March, as compared to the same period of time last year, especially for mandated reporters. This deeply concerning statistic led the Office of the Child Advocate to launch a PSA campaign to help struggling parents connect to their local family resource center through the Mass 211 service. I was proud to assist the OCA by encouraging my colleagues in the legislature to share the campaign materials with their constituents so we could ensure this vital information was reaching families across the Commonwealth. Additionally, there is the long-standing divide between those families who have access to high-speed internet and those who do not. This divide has widened during the pandemic as many schools are relying heavily on internet-based learning, and this includes children in foster care. I have been deeply troubled by reports of rural students sitting in parking lots to access Wi-Fi because they have no reliable broadband connection at home. I am hopeful that we will be able to improve the infrastructure systems and invest in digital equity. This was actually a major priority as the Massachusetts House of Representatives debated the budget last week. I'm thrilled that the House of Representatives and the State Senate are now in the final stages of negotiating a large DCF reform bill, which will provide much needed reporting requirements, reforms, and resources for foster families. It was critical to see important legislation like the Foster Parents Bill of Rights, which originated in my committee, and in working with the sponsors of the legislation, was able to have this bill included in the final draft of the reform package. I envision this Bill of Rights will give foster families the comfort of knowing what their rights are and making it clear that these rights are respected by the department. Additionally, the Department of Children and Families Reform Bill, the DCF Reform Bill, will include more clinical oversight and review of cases before children are allowed to return home. So we've had situations that we want to make sure the homes that they return to are safe. And this new process will hopefully balance children's safety and the reunification of families. Another important piece included in the final DCF bill, reform bill, is data reporting reform, a result of 3 years of work by the Task Force on Child Welfare Data Reporting. This task force came about after many meetings with EOHHS, DCF, and the advocates to discuss what reports should be required of DCF, and was successfully established through a budget amendment. We needed to all sit down together around a table and decide what data was actually needed to make informed policy decisions to best serve our state's most vulnerable children and families. In December 2019, the Department of Children and Families actually released its first of its kind annual report, which was one of the major recommendations of the task force. This was the very first time the legislature and the public were provided with comprehensive, modern, and relevant data about DCF and the needs of children and families it serves. And I'm proud to say that the second annual report was just released in October of 2020. And these reports are actually available online if you go to mass.gov and the Department of Children and Families. Through the data in the annual report, we have now learned a lot about the LGBTQ youth and racial disparities at DCF. We know definitively that about 44,400 children are served by the department, and 47% of them are Black or Hispanic Latinx. This data informs us of the current inequities in our Commonwealth and motivates us to ensure a just and fair system of care. I'm committed to building the work of this task force to ensure we have more accurate data on the educational well-being of children in foster care. You all know too well that the educational outcomes of many of the children who have experienced foster care can be drastically different than their non-foster care peers. It is important for us as policymakers to have a clear picture of the needs of these children so we can improve policy and allocate resources effectively. Like building a stronger broadband system is important, and creating an electronic backpack to help transfer records of children in foster care. During this time of year, I'm especially thankful for the organizations like the Federation for Children with Special Needs, and for all of you who are here today who love, help, and care for children in foster care. We all know there are many families struggling to stay together, and children and families experiencing trauma and looking for stability and love. I thank you all for your commitment to this work and to the children you advocate for. Their lives will be positively impacted because of it. I also feel extremely lucky to have a dedicated, hardworking staff. We call ourselves Team Kahn, and we and the Joint Committee on Children and Families and Persons with Disabilities are fully invested in doing the work that ensures a safer and healthier community for all. I wish you all good health and happiness during the tough months ahead. And thank you again for inviting me to say a few words to you today. Thank you.